Very interesting case out of Westchester, Ohio. Case about ivermectin, patient rights, and standard of care. Jeffrey Smith got COVID in July. He went into the hospital in July. Probably got COVID earlier. Went into the hospital in July. He's been in the hospital for 2 months. They heard about COVID, ivermectin for COVID. He and his wife Julie, they decided they wanted to try it, based on what I understand from the news. Hospital said, hey, that's not standard of care. We're not going to give him ivermectin. Now, all the news stories are spinning this as, well, the FDA says humans shouldn't be taking veterinary medicine. The doses are different. It might not be safe. You might overdose. Totally irrelevant. Like spinning it as some fringe conspiracy theory, wacko, out in the weeds kind of stuff, which is not what they're requesting, right? They're never requesting horse paste in the hospital. They're requesting pharmaceutical care that diverges from the standard of care that the hospital is providing. So hearing this, well, it's 2 months. He's been in there for 2 months. You know, from my understanding, the ivermectin is helpful as a prophylactic, and it's helpful in early stages. Late stages, not so much. In the late stages of COVID, what happens is the immune system will attack healthy tissue, causing further inflammation and further attacking of that healthy tissue. So it causes a lot of tissue damage and fibrosis. Now, for treating that, we have another study, a very small sample size, that gave rise to the proposal for a clinical trial that's currently underway. And that small study is on 2 different groups. One got Aviptadil, which is vasoactive intestinal peptide. The other got standard of care. The Aviptadil group was 21 in size, in number, and the standard of care was 24. Out of the standard of care, 24, 4 of them survived. Only 4 survived. Out of the Aviptadil group, 19 survived. So big difference. Again, tiny sample sizes. Right? This is not, we need bigger sample sizes to prove efficacy. But then, you also have to look at it from the other perspective, is what kind of harm and what kind of risk are we getting ourselves into with this thing, this vasoactive intestinal peptide. And there's not a whole lot of medical literature on it, but it is a naturally occurring peptide. It's fairly safe, and peptides in general are fairly safe. They're out of your system soon. They're small chains of amino acids, and they signal and they fit into slots in the body that will provide signals for the body to do different things. Very simple, very well known, insulin is a peptide hormone that provides signals to the body to lower blood sugar, right? It takes blood sugar and it feeds it into tissues. Insulin. Vasoactive intestinal peptide is a different peptide. It's just a small chain of amino acids. You can buy it. You can buy synthetic vasoactive intestinal peptide and inject it yourself. So I called the hospital and I wanted to just leave my number because it's a very interesting case. I wanted to leave my number so that Julie Smith, his wife, could call and talk to me. And the hospital was extremely rude, like unnecessary. I thought, Ohio, they're probably nice, probably nice to me. I'll just leave my name, my phone number. I'm not going to bother them. Just here, take my name and number. Julie Smith, if she calls me, cool. If she doesn't call me, well, her loss, I'm just going to give her my name and number, tell her about vasoactive intestinal peptide, and then talk to her, see what's going on with her. If she doesn't want to call me, she doesn't want to talk to me. If she wants to say, hey, Garrett, we don't want to talk to you. You're just some weird dude. Just mind your own business. Okay, I'll mind my own business. But I thought I'd give it to her. That gives her the option. It puts the ball in her court, gives her the option to call me. The hospital, the nurse was like, she just wanted to fight with me. And she's eventually like, I have a patient right now, and hung up the phone on me. So I said, I'll talk to you in 10 minutes. So I call back in 10 minutes. I couldn't even get through to that nurse. I talked to the front desk lady at the ICU, and that lady, she already got the word back from that lady, and she was mad at me. She was already mad at me. I'm like, well, I just want to leave my number. And she said, well, it's a policy of our hospital. We can't take any messages from any people. And I said, oh, so it's a policy. Can you show me that policy? Because I'd like to understand your policy better. Where can I find that policy online? And she said, well, it's HIPAA. And I said, well, no, HIPAA protects patient privacy. And I'm not asking for any patient details at all. She said, you're calling in the middle of the night to ask for somebody who's not even here. I said, yeah, it's the middle of the night. I don't expect her to be there. That's why I want to leave my number. So she can call me if she wants to. She doesn't have to. I'm not forcing anything. Just asking to write my name and number down. Pass a note on here. This dude wanted to talk to you. Some weird dude called in the middle of the night. Don't call him if you don't want to. It's up to you. That's it. She wouldn't do it. She hung up on me. She got rude again. She got snotty. Sir, sir, sir. Like this to me. I'm like, what the hell is wrong with these people? So again, we got a situation with an institution, medical institution, where the institution wants to do things the way they want to do it. Now, there is an argument to be made for why they're doing things the way they do them. They have their procedures. They have their policies. They want to do things a certain way because there are liability issues, right? If the institution, let's say Julie Smith, we're going to say, hey, we want to try this vasoactive intestinal peptide stuff. And the institution gives it to him. And let's say he has a heart attack. Well, whose fault is that? And who's getting sued? So there are reasons why the institution won't want to take these risks. So we do have a number of conflicting issues and a number of different people having different perspectives on this. From a human rights perspective, it is that person's body. It is Jeffrey Smith's body. And if he does want to take ivermectin, it seems to be the case that, it's safe. It does have very low side effects. Those side effects are not severe. And if it can be administered safely by a physician, then he should have the right to have that. But since it's gone on 2 months, now we have to consider, is it going to be effective 2 months into this thing while you're in the ICU? Ooh, maybe not so much. Maybe if you'd gotten it, 8 weeks ago, maybe, but now we're not sure. However, it is still a patient rights thing. We have to say, well, might as well try. Unfortunately, it's gotten to the point where they had to go to court, and it took so long to get that approval that they didn't get it in a timely fashion, which led to the situation that they're in now, unfortunately. But maybe it's not too late for them to try vasoactive intestinal peptide, which again, I wouldn't expect the hospital to administer due to liability issues, but it's something that potentially they could look into themselves. Now, a lot of people are going to say, wow, you shouldn't be taking drugs. Yeah, well, whatever. That's what they tell you, drugs are bad, okay? But a lot of people do take drugs, and if you're able to figure out which drugs are okay to take and which might be safe and what are the risks involved in that, you can do your own research and you can make your own decisions. A lot of people do drugs. So anyway, if Julie Smith wants to ask me about vasoactive intestinal peptide, I'll tell her what I know. Just leave a comment.